Hello, my name is Sean Willis. I'm a physiotherapist at University Hospital at London Health Sciences Centre, and we're going to go over the application of the Cryo cuff. We'll typically see this with our post-operative sports medicine patients. Most often we'll see it with our ACL reconstructions. Sometimes we'll see it with our high tibial osteotomies and meniscal repairs, and it's often applied post-operatively. There are essentially two components of the Cryo cuff. You have the cuff itself, which fills with cold or ice water, and this will be around the patient's knee. And you have the cooler, which basically contains the water and ice that will be moving back and forth within the cuff. What we're going to do next is we're going to go over how to fill the jug or the cooler, and then we'll show how to change the water within the cuff. So what we're going to do here is we're going to fill the cooler with the ice and the water. So to do that, you're going to have to remove the top. Unscrew the top, and inside there's a foil top. That will be the last thing that will go back into the cooler. And inside the cooler, what you want to be aware of is that there's a water line. It says H2O. So what we're going to be doing is filling up the jug with water first, up to that water line. Ideally cold water or room temperature water will be sufficient. And then once that jug is filled with water to the water line, what we're going to do is put in ice. Now in terms of the type of ice, crushed ice, cubed ice, whatever the patient has access to will be sufficient. Essentially we just want to try and make the water as cold as possible. And so we're basically putting as much ice in here as the jug will handle, and we basically go right up to the top of the jug. And as you can see, the jug is pretty full there with ice. We're going to put the foil top back on it and close it back up, and then we're ready to put this water and attach it to the Cryo cuff to the knee. So we're going to apply the Cryo cuff. Now there is Velcro adjustments on the front, so you can make it a little bit more snug or a little bit looser depending on the size of the leg. The hole here is basically where the kneecap would go, and what we'll be doing is sliding the straps underneath the leg and attaching them to the Velcro on the opposite side. To fill the jug with, or to fill the cuff with ice water from the jug, what you'll be doing is connecting the jug to the cuff, lifting the tab on the top of the jug, and having the jug higher than the leg. And what the patient should feel is cold water or cool water going into the cuff. And we let that fill basically until all the wrinkles are out of the cuff itself. So we want a fair amount of water within that cuff. And you'll start to see as the cuff starts to bulge out as it fills with the water. When the cuff is full, disconnect. And what we tell patients is that the water in that cuff will last for anywhere between 20 to 30 minutes. So for the first week or so that they're home, we often expect that they're changing the cuff, the water in the cuff, about every half hour, 40 minutes that they're awake. And they can pretty much walk with the cuff on, they can rest with the cuff on. We do ask that they remove the cuff when they're doing their exercises, and by all means they can remove the cuff when they're going to sleep. But we do ask that they use the cuff fairly frequently for that first week that they're home after surgery. To empty the cuff, after 30 or 40 minutes, what you're going to do is reconnect the jug to the cuff. Again, have the tab on the jug lifted up, and this time you're going to have the jug lower than the leg, and the cuff will drain back into the jug. I will often teach patients to facilitate the emptying of the cuff by kind of basically milking the water out of the cuff, so pushing it out towards the tubing or the top of the cuff. And as you can see, the cuff now, for the most part, is fairly empty. Once the cuff itself is empty, what you want to do is just give the jug a little swirl to remix the water so that it's cold again. Have the jug higher than the leg, and the cuff will refill once more. The water and the ice within the jug should often be changed twice a day, so once in the morning and then usually once in the afternoon. So anywhere between 8 to 10 hours, the water in the jug will stay cold, such that it can be reused fairly frequently throughout the day. and then once again, once the cuff is full, disconnect, and the patient should be good for another half hour, 40 minutes.